a cardiologist in York. Today's video is entitled The Hidden Heart, How Heart Disease in Women Can Look Different. So thank you once again for joining me. Today I want to talk to you about something that is often missed, not because we are not looking, but because we're not always looking in the right place. Heart disease is the leading cause of death in women. Yet time and again I see it under-recognized, underdiagnosed and undertreated. Not because it's rare, but because it doesn't always follow the rules we have been taught. You see, we've been trained, often unconsciously, to think of heart disease in male terms. Crushing pain in the chest, shooting arm pains, classic ECG changes. But women, they present differently. They don't always read from the same script. So in women with heart disease may experience different symptoms. They may experience breathlessness rather than chest pain, nausea, fatigue, dizziness, or even a sense of dread, neck discomfort, jaw discomfort, back discomfort, rather than the typical central heavy crushing chest discomfort. And also, sometimes it can be something really subtle, just an unusual tiredness in the days or weeks before a heart attack. And because these don't fit the typical picture, women are often told it's stress, it's anxiety, it's hormones, it's anything but the heart. But because the biology is different, the risks are different. So women may be prone to conditions that are not seen so commonly in men. One of them is microvascular angina. In microvascular angina, what happens is the small blood vessels get affected. So the heart still gets deprived of blood, but that is because the small blood vessels, the ones that you cannot see easily on the chest, are affected. So the big vessels may look okay. So a typical scenario may be a woman comes in complaining of being breathless or tired or getting some neck discomfort, and the doctor says, okay, let's do an angiogram, and they say, oh, your blood vessels are fine, it must be anxiety. But it may actually be microvascular angina, because even though the big blood vessels are okay, the tiny blood vessels that you cannot see may still be affected. And unfortunately, the patient is then branded as being anxious. So microvascular angina is commonly seen in women. Another condition is spontaneous coronary artery dissection. In spontaneous coronary artery dissection, there is a weakness in one of the inside layers of the blood vessels, the coronary vessels, and that can sometimes dissect. So it starts tearing away and it can cause a flap which may block the blood vessel. And this is a cause of heart attacks, particularly in younger women, often postpartum, sometimes perimenopausal. Another condition that is seen more in women from the heart is something called Takotsubo's cardiomyopathy. And this is where the heart gets stunned because of a sudden surge in stress hormones like adrenaline. It can be triggered by emotional stress, so much more common in women. So, and let's not forget, of course, that women have to endure hormonal changes, pregnancy complications, and autoimmune conditions which disproportionately affect them. And all of these can impact heart health. Why does it matter? Well, if we don't recognize the difference, we risk missing the diagnosis. If we dismiss a woman's breathlessness or her fatigue because her angiogram looks normal, we are not just being imprecise, we are being unjust. Every patient deserves to be heard, but to do that, we have to listen differently. So, if you're a woman or if you care for one, it's important to know this. Trust your body, trust your instincts. If something feels wrong, speak up. If your clinician dismisses you, get a second opinion. Don't just let them put it down to stress or anxiety or something like that. And if you are a clinician, and I'm one, we need to broaden our lens. Because women's hearts may whisper rather than shout. but that doesn't mean that they're not breaking. Thank you once again, as always, for listening. All the best.